Unfortunately, I'm sure there are plenty of you watching today that are experiencing back pain, specifically pain of the spine. But thankfully, a clinical trial might be able to relieve that pain. The Orthopedic Institute of Pennsylvania and Arlington Orthopedics Family of Care utilize the TOPS system to help patients restore motion of the spine. Dr. Stephen DeLuca is here to explain this for us. Thanks for joining us.
Thank you for having me.
And letting us know about this new trial. Can you explain to us what the TOPS clinical trial is?
So the TOPS clinical trial is an FDA-approved national study comparing traditional lumbar spine fusion to a motion-preserving device called the TOPS implant for a degenerative condition of the lumbar spine called lumbar spinal stenosis and degenerative spondylolisthesis, which means a forward slippage of one bone on top of the other. Traditionally, we use a fusion to treat this condition. The fusion places stress at the disc above and below the level of fusion. The goal of the TOPS device is to preserve motion and protect the levels above and below the operative level from developing arthritic changes and causing the patient problems in the future.
Wow. So this sounds pretty revolutionary, and especially when we see it here. Has this type of surgery ever been done prior to this clinical trial?
Currently, this device has been used quite successfully in Europe for over 10 years. This current study has been going on for 6 months. We performed the first of these implants at Pinnacle Health, West Shore Hospital 6 months ago. There's 35 sites across the country that are involved in this study, but we're right here in central Pennsylvania performing our branch of the study.
Sure, right here. Who's the ideal patient for this?
There are strict criteria for the FDA portion of the study. Patients need to be between 35 and 80 years old. It has to be somewhere between the L2 and the L5 levels, so it can involve the very lowest portion of the back called L5S1, just between the L2 and L5. They have to have leg pain more than back pain. Pain is usually relieved with forward bending. They have to have no previous surgery of the lumbar spine, and of course they have to have the spondylolisthesis and the spinal stenosis.
Okay, and if people want to know if there are risks associated with this, what do you tell them?
The risk for the current part of the study with the mobile device is the same as a fusion device. The surgery is essentially the same surgery, but rather than putting the traditional screws and rods across the motion segment, we place this mobile device which will allow motion, which will hopefully preserve the level above and below. So the only difference with the operation is instead of implanting these rods, we implant the device.
Okay.
Biggest risk of any sort of back surgery is that it does not always alleviate back pain completely. Sure. The goal of surgery is to alleviate pressure on the spinal cord and the nerves so that your walking improves, your leg symptoms improve, and we can improve your quality of life. Of course, the secondary goal is to try to alleviate back pain if possible.
Sure. And if someone's listening and they want to find out more, how can they go about learning more about the surgery and then going ahead and scheduling either a consultation or an appointment?
There's links on both the OIP.com and the UPMC Pinnacle websites to the TOPS information, also to our office at OIP. There's contact information there, information about the study, specific inclusion-exclusion criteria, who may be a good candidate, who falls outside the study. So there's contact information there as well regarding appointments.
Okay, great. Anything else that you want patients to know about this before we leave today? You've done a great job answering our questions, but just in case there's anything else.
Yeah, biggest thing is, it's a 5-year study. We're looking to see if we can help preserve the levels above and below the fusion by preserving motion. There's been other implants that have been tried in the past. We're extremely excited about this particular implant because it's very much like a knee or a hip replacement that replaces the actual joint. This device replaces the normal joints of the lumbar spine, preserving more normal mechanics and motion.
Okay, Dr. Stephen DeLuca, thank you so much for joining us today.
Thank you very much.
Thank you.